Hello, I'm Bob Chaloner, the Chief Administrative Officer of Stony Brook Southampton Hospital, and I'd like to welcome you to another edition of Focus on Stony Brook Southampton Hospital, your monthly program about the people, the events, and the services at your community hospital. Today we're going to talk about wounds, a topic that many people think of as a very mundane kind of healthcare topic, but something that's actually much more complicated and frankly life-threatening if not dealt with the appropriate expertise and treatment. And I'm very fortunate to be joined today with Dr. George Koullias, who is a vascular surgeon, board-certified vascular surgeon here at Southampton Hospital, a member of our medical staff, a member of the faculty at Stony Brook University Medical Center, and he's also co-director of our Center for Advanced Wound Healing. And Dr. Koullias will be discussing the latest advances in the treatment of wounds, and particularly chronic wounds, which we'll talk about in a second. Dr. Koullias is also an assistant professor of surgery at the Stony Brook School of Medicine. So welcome, George, and Dr. Koullias. I'd like to
thank you, Bob. Thank you for the invitation.
My pleasure. Number one, I always love to learn a little bit more and have our viewers learn a little bit more about the medical staff. We have a wonderful, very qualified medical staff, and you in particularly have a real level of expertise. So tell us a little bit about yourself and how you ended up here at Southampton Hospital.
Right. Thank you, Bob, for the invitation and for allowing me to present our work to our viewers. I have been practicing for almost 20 years now, and I switched gradually from cardiothoracic surgery, which was my initial scope of practice, to vascular and endovascular surgery.
Right.
Family reasons brought us to the Northeast and eventually to Long Island.
Right.
And I'm very happy to have joined the Stony Brook Southampton Hospital the last 2 years.
Yeah, that's what I was thinking. It's about 2 years.
It's 2 years, yes. Yeah. And we have spearheaded the development of several service lines that I think are very useful for our population.
Right.
One of them is the topic of today's discussion, which is wound care and hyperbaric medicine and the usefulness of these treatment modalities to our patients.
Absolutely. And just before we get into the wound care center, every time I meet people in the lay community, they ask, so how much training did the doctors get? And you've been through not only medical school, but residency programs.
It is 5 years of becoming a general surgeon.
Right.
And then depending on how you do things, between 2 to 4 years of becoming a specialized surgeon.
Right.
And then some people also have additional training for subspecialties.
Right.
So it comes probably to close to a little bit less than a decade of training.
Right.
And that is after medical school.
And
So
you
it's a lot
are
of
a
years.
vascular surgeon, which is
Right.
more specialized than a general surgeon.
Right.
Just could you describe what a vascular surgeon does? in a
We
few words?
I would say the most I would say smart way to describe it is that we deal with everything that has to do with the circulation in our body,
Okay.
with the exception of the brain
Right.
and the heart,
Okay.
which are subjects of other individual specialties, neurosurgery and heart surgery.
Okay. And we'll learn a little bit more about why vascular surgeons are involved with wound healing. But before we do that, could you talk a little bit about our wound center and what a chronic wound center is generally and what we're doing here?
Right. One of the several pleasant surprises upon my arrival here was the wound care center.
Okay.
I discovered the existence of a wonderful group of dedicated nurses and assistants and hyperbaric technicians with a great sense of camaraderie. And I immediately realized that this is a clear focus for expansion and development to offer a more integrated service to our patients. The wound care center in general means a special area of the hospital where people that have any type of wound that doesn't heal after 3 or 4 weeks,
Okay.
can come and seek advice. This can be any type of wound after any initiating event
Okay.
and in any part of the body.
And I was going to ask your role in the wound center also. You're our co-director, so you're really leading a lot of the medical innovation and growth.
Well, the wound care as a field has evolved significantly in the last decade. And many of those recent developments have already been applied at our wound care center at Southampton Hospital. We have many treatment modalities, some of them very recent and very advanced. And the message that I would like to give to our viewers is that I don't think they need to go far or travel long distances, which should not be the case for any patient with a wound, which is usually painful and debilitating.
Right.
And they can seek advice. They will be very happy with what they see at our wound care center.
It's also something that I know the healing of wounds takes multiple treatments usually, so having
Right.
local convenience is important.
That is actually extremely important and a great point. Wound care center means multiple visits. I would say on an average between 15 and 25
Wow, I had no idea.
to the wound care center.
Yeah.
Of course, the more complicated the wound or the larger the wound, the larger the number of visits.
Okay.
But definitely several visits per patient, depending on the nature of the wound. It is a major convenience factor for the patient not to travel and to have advanced management techniques
Right.
and backup support locally.
And I would think having that access is important because if people are, travel can be very inconvenient, especially if you're sick or have an issue like a wound, and if you have
Absolutely.
to travel, you may not be as likely to follow up appropriately, and that's probably a real complication for some folks.
I think these are all very valid points, Bob, because whenever we see non-compliant patients, these are patients that were not able to make durable durable transportation arrangements.
Right.
People usually have wounds that are painful.
Right.
The majority of those wounds are in the extremities. Those wounds cause trouble with walking, trouble with driving.
Right.
A lot of our patients are dependent on driving assistance.
Okay.
And that is something that I also would like to comment on our wound care center. We have volunteer services for driving assistance on our patients, and we have a great mechanism of securing that our patients will have access to us.
Right.
And that is something that we don't see in many wound care centers. The sense of more personalized care and attendance to individual needs.
That's right. Yeah, I never thought about that, how important that
It
transport
is
is
very,
for people to access the health
especially in the winter months,
care.
when wounds need to be seen once a week at least,
Right, really?
and the weather is not favorable.
Okay.
I think
More in the winter months that
well, because that's when the driving, I think, and access to us
Oh,
is more
okay.
treacherous.
Difficult,
But the
right.
wounds, of course, don't understand winter and summer.
Right, right.
They need to
right.
be attended
Right, exactly.
12 months out of a year.
So let's talk about wounds now. What exactly is a chronic wound? We use that term chronic wound. What is a chronic
Right.
wound?
I think we touched up briefly in our previous question. Any wound that passes the 4-week mark,
Okay.
there are some exceptions, but an arbitrary limit in the literature is 4 weeks.
Okay.
If we don't see a wound reducing by 50% with what we do by 4 weeks from the time we saw it, it classifies in the literature as chronic wound.
Chronic wound. Okay.
And that is not a completely arbitrary number, the 4 weeks, 50%, 40 to 50% reduction. It has been proven that wounds that pass the 4-week mark, then the progress stalls.
Right.
And that's when we absolutely need to have input from specialized wound care centers.
Okay. And so what are the underlying causes of why will, you know, most wounds seem
Right.
like they just heal up on their own, just
Right.
keep them clean and...
Absolutely. I think these are well proven, time-honored rules for
Right.
wound care. You know, make sure that we are clean, make sure that we are covered, we protect them. There are, although, some factors that sometimes, when they exist, they just affect those wounds, and those wounds don't heal. The most common factor that everybody would potentially identify by having somebody in their surroundings or their environment is diabetes. People that are diabetic, when they have wounds, usually they're in the lower extremities, in the feet. And they have multiple reasons because of their diabetes not to be able to heal the wounds.
Okay.
One of them is that diabetic people have a higher incidence of infection, and an infection in the wound will definitely delay wound healing.
Okay.
The other reason that has to do with my specialty, and we see it frequently intertwined with wounds, is vascular insufficiency. Diabetic people usually also have blockages in their arteries.
Okay.
So not enough oxygen, not enough antibiotics are going to the wound area
All right.
since the arteries are blocked.
All right.
It's our job to assist those patients with the appropriate vascular interventions. So the tools that we have will be actually able to reach the wound area and heal the wound.
Okay. So it's getting that blood supply and oxygen, the body's natural healing elements.
Our
to the wound.
oxygen,
Right.
another important part of wound healing is the hyperbaric oxygen.
Right.
And that is something that also cannot reach the wound if there is no blood vessels to bring the oxygen in the area of the wound. So having good circulation is paramount to be able to heal the wound. And I think the third most important reason, which is actually the second most common reason, is venous insufficiency.
Okay.
A lot of people have varicose veins, have swollen legs, swollen ankles, and wounds that are created by even a simple accident at the beach, the backyard, walking, or doing something at home. Because of the venous congestion, they don't heal, or they heal in a very delayed fashion. It's our job to identify that as a reason of venous insufficiency that is widespread, and assist those patients by treating their venous disease to heal their wounds.
Okay. Are there types of wounds that we do treat and some that we don't? What types of wounds, I guess I would say, are we seeing in our wound center?
I would say that our wound care center has developed significantly the last year and a half, and now we see all wounds that can be seen in any other wound center in the country. We see wounds that have medical reasons, as I just mentioned, diabetes,
Right.
venous insufficiency, arterial insufficiency. We also have wounds that are from natural reasons, accidents, insect bites, spider bites.
Spider bites, I've heard of spider
Right,
bites.
right,
creating
right.
real-
And these are sometimes wounds that are they require immediate attention because they are associated with rapid skin changes.
Okay.
And with a simple spider bite in 6 hours, you can have a big wound that is really very frightening to the patient.
Okay.
We also have wounds that are what we call iatrogenic, meaning they are caused by doctors.
Okay.
So it's good to know that when we try to heal a patient with cancer
Okay.
using radiation, we cure the patient's problem, but 10 to 15 years down the road, the area that was radiated at the skin level is prone to wound formation.
Okay.
So we see a lot of them, and I think that these are resistant wounds, meaning difficult to heal,
Right.
that in my book they should not follow the 4-week mark.
Okay.
But anybody with a history of radiation should show up the next morning when they see a wound, and just don't wait for this wound to be established as a non-healing wound.
Well, I was going to just follow up on that. When When should someone come to a wound center such as ours? I mean, we all get wounded periodically, and when would you recommend that somebody?
I think there are a few very simple and I would say intuitive rules. One is when we don't see the progress that we would expect to see on ourselves. We know from previous experiences when we are younger, how long does it take for our body to heal a wound? If we don't see that sequence,
Right.
or if we see symptoms that were not there before, and the most frequent symptom would be increasing instead of decreasing pain,
Okay.
or increasing instead of subsiding redness,
Right.
or drainage,
Right.
that if all those things that are normal for wounds don't improve, I think we should seek advice from the wound care center.
Okay.
The time limits for that are not specific, but I would say that a wound that does not show clear progress by 7 days deserves an evaluation by a wound care center.
And what might happen if you don't treat it appropriately?
Well, I hate to terrorize patients, but we see so many of our patients that show up late.
Okay.
And that means sometimes serious medical complications, sometimes limb loss or loss of parts of our limbs,
Okay.
sometimes, as we initially said in our conversation, multiple visits to the wound care center.
Right.
For a wound that could have been healed with 10 or 6 visits, we have people with 45 visits.
Wow.
Imagine 45 weekly visits.
Right.
Multiple treatments, multiple sessions of intravenous antibiotics,
Right.
multiple surgical procedures. So a problem that could have been dealt with more efficiently early now becomes a bigger problem with bigger utilization of resources.
Right.
Definitely more requires higher commitment levels from the patient standpoint. And I think the sooner we realize that this is not something that heals as fast as we want it, and again, the patient is the best judge of that. He will realize that this is not going the way he thought it should be going.
Right.
I think if we have this internal, I would say, bell that keeps ringing and tells us that this is not something as we have been used to see, I think we should definitely address it with our primary care physician,
Right.
or just make a simple phone call to the Southampton Hospital Wound Care Center. We see a lot of self-referred and patients that just come in for a simple opinion, and we'll be happy to see them, because I think that the secret is early management of those problems.
Right. Like anything in healthcare, the sooner we tackle it,
Exactly.
the better off
Yes,
we are.
yes.
And I always like to tell, I hear from people all the time, oh, I went to get it checked out and it wasn't really anything, so I'm kind of embarrassed that I even went. And I think you would agree, we'd much rather people come
Absolutely.
and don't be, we don't want to, ideally, we're not
Right.
going to find anything, but we'd much rather you come and get checked out. than,
Right, right,
than
and we
wait.
see a lot of those patients, and some people feel embarrassed. I personally try to compliment them
Right.
that they have these initiatives
That's right.
to take care of those issues preemptively.
That's exactly right.
There's another group of patients that we've seen a lot recently at our wound care center, and I'm very happy to report that this group is increasing. Is people that they used to go to the city for wound care issues.
Mhm.
Imagine if you have a wound care issue, let's say a foot wound, a diabetic foot ulcer, which is the usual, I would say, wound on the foot of a diabetic patient.
Right.
And you need to address it by frequent weekly trips in New York City from our area.
Right. Which is a lot of
Yes.
a lot of time. Right.
Exactly. So we see a lot of patients that are transferring care to our center.
Right.
And that makes us very happy because we see them being satisfied.
So let's talk a little bit about how we treat and the techniques that you use. And first of all, what are the factors that affect healing of a wound? What are some of the key things that you're trying to promote?
We briefly touched that upon on our previous conversation. There are things that we need to make sure they are present when we evaluate a patient with a wound.
Right.
We need to have good blood supply. We need to make sure that we don't have medical comorbidities, meaning serious medical problems that can make that wound chronic. They are very common medical problems. The one that we touched upon briefly before, diabetes. We need to make sure that if we are diabetic, that our diabetes is well controlled. There are some other serious comorbidities that are common but very easily treatable. Thyroid disease. We need to make sure that our cortisol levels sometimes are not either low or high. That also affects wound healing. And also, if the patient has a chronic problem that is being treated by other physicians, and I'll give you a very simple example, let's say rheumatoid arthritis treated by a rheumatologist, we need to, and we always do, we get in touch with the other doctors, because the treatment for those entities on many occasions stalls the treatment of wounds.
Oh, really? The medications or the...
Exactly. A lot of those treatments are, as we call them, immunomodulating, are targeting the primary problem of the patient by targeting his immune system. But by treating that favorably, sometimes you cause other problems. One of them is wounds. Not that these treatments create wounds, but they just stall the closure of the wounds. So many doctors are involved. It's our job to make sure that we have a good interaction and that we have a continuity of care with our patients. We have dedicated nurses and medical assistants that bring all the necessary medical information for us to make decisions.
It seems that we're seeing a lot more, or at least my perception is that we're hearing more about wounds. In your opinion, are there more wounds because of increasing incidence of diabetes and also because people are living longer? Is that a possibility? Or?
Absolutely. I would attribute the increased incidence of wounds to a few of those factors. Definitely increase and rising incidence of diabetes of any type, increasing lifespan. People are more active now at their later years versus 30 or 40 years ago. They don't assume the role of an elderly patient. They're active. They want to go out. They want to live their lives the way they would like to, and that sometimes, of course, is associated with injuries, wounds. And as I said, multiple treatments of modern diseases are associated with the formation or the chronicity of wounds. Wound care is evolving into a very dynamic specialty with very advanced treatments that have surfaced the last 5 to 7 years. And I'm happy to report that we follow all those advanced and we apply them all at our center.
And I'd like to
with very good results.
Yeah, I'd like to talk to you about some of those, but I have to ask this question because we hear about it all the time in the Hamptons, is the burgeoning tick population. Do ticks, do tick bites ever lead to wounds? Have you seen that? They do.
They do. Not frequently, but they do. They do in the right setup. And again, this has to do with what other comorbidities does the patient have. Is there a patient with swollen legs and venous insufficiency? A tick at the lower extremity on those, a tick bite would lead to a wound. Is the patient living outdoors? We have many patients that are actually fishermen, and they have wounds because they go in and out of the water in areas that have high bacterial loads or in the sand. This is a frequent occurrence of wounds in the lower extremities in people that work with boats, and in the water.
Right.
Definitely ticks can cause something like that in the right setting, on a venous insufficiency or in a diabetic patient setting.
Okay. Interesting. So you mentioned, let's talk about some of the treatments and the innovative things you're doing. And one of the things that I'm always fascinated with is hyperbaric oxygen therapy. Can you just describe what is it and why it's used in the treatment of wounds?
It is something that we have as a, I think it's a wonderful, significant resource
Right.
that has been around for many years.
Right.
But the indications and when to use it and how to use it have been evolving. It's a matter also of significant critique from the medical community when it comes to when to use that. I have seen miraculous recoveries on my patients with the use of hyperbaric oxygen treatments.
Right.
I think that it's a wonderful treatment modality that we have available at Southampton Hospital.
Right, I think we're the only hyperbaric facility out on the East End.
Right. I would say that we are the only facility that provides hyperbaric medicine at the eastern part of Suffolk County.
Right.
Definitely, actually in both forks, to the best of my knowledge.
Right.
This treatment, as I said, has been around for a long time, has been used for decompression of divers with diver sickness, but in the process has been applied to treatment of patients with medical diseases. There has been a change in where we can apply hyperbaric oxygen therapy recently, the last decade, what patients, but I can summarize, and without going into details, I would say that people that have resistant infections are diabetic, or their infections involve the bone, or have had what we call traumatic brain injuries,
Okay.
are, amongst others, indications that are applicable to hyperbaric therapy.
Right.
And we can see significant improvements.
And just so people know, what is the experience for a patient? What happens when you're
Well,
getting
the
out of there?
hyperbaric chamber is something that I would say imagine a glass capsule.
Okay.
There is a claustrophobic factor
Right.
involved. The fact that it's all glass and we have music and TVs makes it a little bit better, but
Right.
the occasional patient may have an adjustment
Right.
issue. But it's a capsule that the patient breathes oxygen in a higher pressure and higher concentration for a 1 to 2 hour a day interval.
Okay.
The principle of that is that oxygen in higher pressure and higher concentration will go to the problem area in higher quantities.
Okay.
That can have curative results for wounds, for bone infections, for cerebral issues, and I would say that, without getting into more details, as a category of patients that have diseases in the central nervous system, that literature comes out recently favoring the use of hyperbaric medicine.
Good. So it's all about getting that higher dose of oxygen. out.
Exactly.
Can you talk a little bit about skin substitutes too? And I know that's a very, you personally have been a big proponent of some of the new treatments and things, and that's a wonderful new area of innovation.
It's, as we said before, wound care has been evolving into a, relatively speaking, independent subspecialty in medicine. A lot of other sciences, or I would say disciplines, have been involved into developing wound care. A lot of molecular biology techniques, conventional biology techniques have been giving a lot of, I would say, scientific help to wound care. We know today that wounds don't heal because there are certain biochemical factors that are missing.
Right.
So the skin substitutes are essentially either human or animal membranes. Could be a placenta, or it could be a membrane from porcine intestine. that has high concentrations of these growth factors that are missing for the wound to jumpstart the healing process.
Right.
These are highly specialized products that have shown tremendous potential to heal wounds that even in the early 2000s would take 1.5 to 2 years to heal.
1.5 to 2 years. Wow.
Yes, now we can heal them in a matter of less than 3 months.
Wow.
They have significantly speed up the healing time. They're not for everybody. They have indications, contraindications. We have been spearheading the development of some of those products, and we also have been participating in testing trials because of our significant expertise in this area, and we are opinion leaders on those products in a national level.
Right.
When it comes to how to use them. And I'm very satisfied with the results. A lot of our patients heal faster, and they don't have to experience this multiple back and forth to the wound care center that decreases the compliance.
Right.
And upsets the patient, frustrates them. And then when the patient doesn't see a lot of progress, usually they're not going to come back.
Right.
And then the wound, when they come back, will be
It's
significantly worse.
So we unfortunately have time for just a couple very last questions. Very quickly, Dr. Koullias, you talked about vascular insufficiency, and how do we test for that? How do we tell if somebody's getting appropriate blood supply to their wound area or limb?
That is a wonderful question that is very relevant to wound healing, since every patient that has a wound needs a thorough assessment of his arterial and venous circulation. And I'm happy to report that we are in the final phases of having a fully integrated vascular laboratory that is going to be working in conjunction with our wound care center.
Wonderful.
And by saying that, just to be a little bit more clear, is a part of the hospital that is dedicated into providing high-quality vascular ultrasounds for every part of the venous and the arterial system of the body.
Wonderful.
Patients come in with individual appointments, could be from the wound care center, could be referrals from our surrounding primary care physicians, and we can provide high-quality testing by certified vascular technologists. And the lab would also be certified and will work in conjunction with our main vascular lab in Stony Brook. It is something that it is a service that has been partially available up to now. We're just expanding this service, making it more concentrated, more integrated, and now we offer the full gamut of vascular testing in a very nice environment. That helps, as I mentioned before, also the wound care patients, because they definitely need all those tests for us to assess their wound healing process.
That's wonderful. Thank you, and thank you for your development on that. Just the very last quick question is, somebody once worried about a wound, we'd always encourage somebody to see their primary care physician. If they don't have one locally, can they just make an appointment directly with the wound care center?
Absolutely. We encourage that, because of a lot of our patients have seasonal arrangements in the area. Majority of our patients, I would say, have primary care physicians. But a good amount of them, they don't have primary care physicians local, or their primary care physicians are in the city.
Right.
I think it's very simple to just call the main number at Southampton Hospital and ask them to be connected with the wound care center. And we will be happy to see them, advise them on what we should do. And we actually go the extra mile, especially in the summer months when our volumes are significantly higher, to extend our hours and to see everybody.
That's wonderful. Thank you so much.
You're welcome, and thank you for the invitation to this wonderful show.
My pleasure. We are very lucky to have you in our community.
Thank you. I'm very happy to be here.
Dr. Koullias. And I'd like to thank all of you as well for joining us today. If you have any questions or concerns or would like to get a hold of our wound center, you may be worried about your own wound or the wound of a loved one, please call our Center for Advanced Wound Healing at 631-726-3300. You can also find us on the hospital's website under the Physician and Services section at www.southampton.stonybrookmedicine.edu. And once again, I'd like to thank everyone involved in putting this program together, our friends at CTV for producing this show and airing it in our Southampton communities. I'd like to thank LTV for airing the program in our East Hampton communities. And I'd like to thank all of you for watching and your ideas. If you have any questions, concerns, ideas for future programs, or just need help navigating the healthcare system on the East End, please feel free to call my office at 631-726-8555. Thank you, everyone, and good health.